Love it. I love it. Well, I am Dr. Yolanda Cintron, and this is Dr. Yolie Podcast. Today, I'm so excited because I have somebody very special. I have a person that has been trained. We have one of the same mentors between many of the mentors that we have learned from, Dr. Thomas Raton. So I was trained by him, and I learned about all the different pillars of health. And I'm so excited to speak to somebody that actually has been trained with him and has a wide understanding that the body is all connected, and we're not divided by sections. Not only our body is one, but also we have spirit, we have mind, we have thoughts, and we have our hearts, which is our soul. So please welcome Dr. Marina Yuabova. Am I saying it right?
You're saying it right. And thank you very much for inviting me to your podcast. I'm very excited. I'm here to share beautiful information for people to really understand how everything's connected so they can understand how really body works.
I love it. So, tell me a little bit about you. You have the accent. You told me you're Russian. Where are you from?
I'm from very specific part of Russia that's very close to Asia. It's actually very close to China. So if you take a horse, it takes you a week on a horse to get to China. It's very, very close.
Wow, that's so amazing. So, it's fascinating because, there's so much division in the world. And that's one of the, plans. God unites people, but we know that there's spiritual forces that divide people. So, I am inspired in 2026 to bring a community of people together, for us to share our portion because, I cannot be an expert in everything, but I am interested in learning what you know and how we can share with our audience. I have 12,000 patients that seek information because they trust us. But there's so much information out there, and I want to know how, when you see somebody, what is it that you're finding lately? What are the things that are happening? So I'm gonna let you roll with that.
Sure. So I see a very big shift. Number one, that younger people are sicker.
Yes.
People coming with all different kind of problems. Kids are not well either. Like we used to think if they're young, they got to be strong and they got to be resilient. It's no longer the case. Cognitive decline is now for everybody. We used to say, oh, you're 80s or you're old and that's kind of okay. Now we have in mid 40s, mid 30s, people complain with brain fog. Young kids, ADD, HDD, it's also cognitive function. Inability to have this focus, it's a cognitive function. We are not looking at that this way. People don't, but we should. So what's going on in the world that our function is changing, and obviously it's going to impact generational health, right? We think about it now. Now I have patients that coming, they're younger and younger and have struggled with fertility, men and women. For men, not enough testosterone, to women, early perimenopause and menopause. So when it's time for them to actually reproduce, it's like mid 30s and they're done. It's so alarming right now. It's very alarming.
So, you gave us a lot of things to unpack. So I agree with you. I am seeing people in their 20s and early 30s with cancer. I am seeing patients that are coming with, cognitive decline. This week we had a lady, she is in her early 70s, but she has been with dementia in an institution for a long time. So, that affects the family, that affects the daughter. Now, they had no idea of the inflammation in the mouth and also the dead teeth, the abscesses, and the mercury. How can somebody, most probably she was in pain, but because she cannot speak and she's not connecting, she could not communicate the tremendous amount of inflammation that she has in her mouth, infection going to her brain. Now, I told the daughter, let's do a CT scan on you. And she has a number of mercury fillings that that they're neurotoxins. So, then mercury travels 4 generations. So somebody might have cognitive decline. They might have anxiety is another thing that happens with the mercury. How do you, what is your plan? You have somebody say like her, she, first we got to clean her up and, open the pathways. But what will you do for a patient like that?
Firstly, let's touch on points of how people get that way. So we can
Yeah.
actually guide them how to get them out of this way. So
Yeah. Good idea.
statistically, we know that women suffer with cognitive decline by 30% more than men do. First of
Why
all
do
and
you think
foremost.
is that? Why do you think is
So
that?
I will explain to, I don't think, I know for a fact, research is there to back it up. We are very hormone sensitive beings. We have receptor sites of estrogen, progesterone in our brain too. So when women go, we as women, we go through perimenopause and menopause, and if there's not proper care to replace what's missing for proper function, cognition goes. You can see women in early menopause where they are losing their cognitive function. They will say, oh, my brain is so fogged and I'm
Yeah.
constantly forgetting things. You know, it's like when you're pregnant. Women, when pregnant, brain swells because it's too much progesterone, right? It's a hormone, and women get very forgetful. So when women become perimenopausal, again, not enough proper hormones. Nobody replaces them because now everybody is saying, you know, aging is normal. Yes, it is normal, but losing your function and losing your identity, it is not normal. That's number one. Number two, thyroid function. So we have thyroid, it's very important gland for cognitive function. People don't talk about it enough. It should be spoken enough about. So if thyroid function is suboptimal, it will impact cognitive function. So we know patients with suboptimal levels of thyroid function, they have anxiety and depression. The same thing with overly active thyroid function. So this thyroid function plays a great role, but what's happening? Why now we have people that are thyroid deficient? So statistically, again, we have every third woman with autoimmune condition, Hashimoto's thyroiditis. So if every third woman has autoimmune condition, you already know how she's going to be aging because her thyroid is not optimum because now she has immune dysregulated problem that's affecting her cognitive function. You see, everything is looping. It's like one after the other and everything is together. Inflammation as is, people are inflamed because people are toxic. We're going to go now into gut. Gut is not optimized. Lots of people having leaky gut problem. Gut is your first brain, not even a second brain. Because when we're developing as embryos, the first organs that develops, it's the gut and then the brain. So if we have gut issues, we're going to have cognitive issues. You see, like all of this is very much in tune. So for somebody like her, firstly, we need to understand what's in her mouth, how toxic she is. Like we need to understand where toxicity is coming from. More toxic people, more problem they will have with their cognitive function because they are highly inflamed. Mercury in the mouth creates disruption in blood-brain barrier. So this blood-brain barrier gets distorted, doesn't work properly, and now toxins move into the brain and causes whole bit of inflammation in the brain. And now people have these symptoms. So if somebody has mercury fillings in their mouth and they decide to go and do great detox without any prep, they go to somebody and that somebody starts drilling, what happens? So we know if you have mercury fillings for a prolonged period of time, more than 10 years, the mercury is already in your bones. You start drilling, you didn't prep patients, this mercury now elevates and becomes systemic, and people have systemic toxicity. These patients without proper prep, they get extremely ill. This is not the proper way of doing it. So proper way of doing it, of course, we need to understand what's wrong, where it's coming from. We need to, for example, about this lovely lady, understand how toxic she is and how deficient she is. Why is it so important? Yes, we know she's toxic. How is she deficient? What is missing to do this beautiful work of cleaning up? Detoxification, to do clean up in your system, you need to have energy. If you don't have proper vitamins, minerals, nutrients, your lymph, your liver, your kidneys, your skin is not working properly to detoxify, you're going to get patient very ill. So every little step needs proper sequence. How insulin resistant is she? She's insulin resistant because now we hear about type 3 diabetes affecting, brain function. Yes, it's patients with Alzheimer's disease. They check, most of these patients don't have diabetes. They are pre-diabetic. So when you have patients with pre-diabetes, they really don't get treated. They get nothing. So their cognitive function will decline. So we need to do what? Stabilize their blood sugar, make sure it's no longer causing inflammation in their brain. So it's a lots of different layers. So let's go down lower for gut function. Inflamed gut, inflamed brain. We have to correct the function in the gut. So this is what's interesting. If somebody has chronic inflammation in a gut, we know they're not going to be able to absorb nutrients. It's just fact. If you're giving them something orally, it's just a waste. They cannot absorb it. So this is how we replace that with IV nutritional therapy. Give them nutrients through the vein, through the bag. So now it's 100% absorption. So we have to replace things first, give them energy first, regulate their hormones first. Yes, there are lots of peptides we can use to reduce inflammation as soon as possible. Patients need to change diet. If they're eating something that causes all of this inflammation as well, adds to everything, we need to change their diet. It is very specific approach to change somebody else's outcome. This is so important, but changing somebody else's outcome can change their life. They can change their family life. Can you imagine you're a young individual being in your early 70s, mid 70s? You're not old. You should be able to function. You should be able to enjoy your life.
The sad part is that we're getting younger and younger people, and then they're not connecting the dots, you know? I have young people with actually loaded with mercury, root canals, abscesses, and they're like, I'm doing everything right. Why do I have cancer? And, it's like such a, how do you start getting to the top of Mount Everest? You have to start with the first step, like learning that
We
you're not
educate. Yes,
you're not doing
education.
everything right. If you have cancer, there's something that is not right.
Right. So very important is patient education. And we spend a
Yes,
lot of times in patient education. Very first consultation, when I have my patient, it takes me almost an hour. Firstly, hear what they're saying. So when they're telling me something, I already hear where it's coming from. I already
right.
understand their physiology.
Yeah,
Before I did it on blood test, I already understand and I start educating them. This is how it actually works. This is how your body gets impacted. So, about a mouth and oral cavity is very specific, and you very well know it because that's your bread and butter. All you do is mouth work. So, we have mucosal membranes and we have a lymphatic system that actually goes and affects the brain first. So, we have meridians in our oral cavity connected to teeth. If teeth are affected, the tissue is dead or it's toxic, it will affect the organ through that meridian. So now we're talking about energy field. So when energy field is affected, this is also toxicity. We're talking about, well, if you have old trauma, its energy field is affected, as well as if you have toxins that gets affected through the meridian. So every tooth connects to the organ. So for patients with cancers, you very well, you're aware, you can look at the tooth and you can figure out where the cancer started from.
absolutely.
There is a
It's
chart you can show to patients.
it's
You can
it's
say,
without
okay,
without fail. We have it in our website, and we actually, before I meet the patient, I look at the CT scan, and I already know where the problems are. Just because that's like the prostate meridian, that's the kidney meridian, that is the urinary tract meridian, the breast meridian, the colon, the intestine. you know. But people are in denial. Like I had a couple come yesterday, and the husband is loaded with mercury. And because of the mercury causes electrical currents, when you have metals and you have saliva, it causes galvanism. So he's wondering what half of the teeth are missing because he grounded them down. But he's like, no, I have this in my mouth mercury since I was like my teens, and now I'm 60 something. So I don't feel that it's caused any problems. And then the wife was like sharing, well, you just are scared about something in your colon. And sure enough, the teeth that were affected and broken down were the ones in the large and small intestine. So I see it. He doesn't know it, but there's a connection. And then there's no urgency because he's not in pain. But a lot of people wait until they're in pain. What do you think about that? Instead of like waiting for things to explode in the brain, how can you speak to a patient about that? We educate them, but most people wait until they're in excruciating pain to come.
this is very common. So it always takes a specific way of educating these patients. I basically paint that story to them. I tell them this is how it starts, this is how it progresses, and this is usually how it ends. And I tell them like when it starts like this, you don't feel anything. When you see signs and systems that your body is reacting, you need to do something about it. You need to, you should not wait because now it's so much easier to overcome a problem. So much easier. It's going to be much less financially investment and you're going to be bouncing back just like that if you wait. For example, patients with cancers, as soon as they hear cancer, they're done. Why wait? Do you understand that your immune system is already triggered? Why are you waiting? Don't wait. Be proactive. See, it's all in their hands. Will they take that step? I explain it to them. And patients with active cancers, I don't take. So when patients in remission, you're more than welcome. Before they get to cancer stage, you're more than welcome. When you are an active cancer stage, it's not the right place for you because you missed so much. And now you already have cancer, you're full of fear, and now you want somebody to do it for you. But that time has been lost. Don't allow for this to happen. Be proactive. You only have one body this lifetime. And yes, environment now is very specific.
Very.
The water, the air, the everything is very specific. We are still original, somewhat. Yes, people now have implants. People now have, all these things in their teeth, fillings. They have implants in their mouth, and everything affects the well-being. And we all know that. So if we are still original somewhat, and then we changing our physiology by having these implants, and that's changing us, and we're not doing anything to progressively support our well-being, what will be the outcome? What's the expectation? So I do tell them, I have some people extremely proactive. They come, they already understand. They went to a few doctors, they didn't understand, and nothing was revealed. Biggest complaint, you know what? I feel A, B, C, D, and F, but I went to my doctor, I went to this, and they said my blood work was normal, nothing needs to be done. They get, released. Nothing is done. No advice is made, no plan is made. Then they come to me and we do our phase 5R process. We want to understand everything, how it's happening, where it's coming from, how can we address it, how can we help this individual. And I create a plan for them. And after blood work, and I explain to them, this is how we're going to do this. And we're going to do this all in the same time. It's not, 2 months we're going to do this, 2 months we're going to, no. We're going to start in the beginning very gently. So reduction of inflammation in the beginning, changing your diet, your specific supplementation. Your hormones are not optimal. Let's give you some nutrition because you're so nutritional deficient. Let's see how your liver and thyroid can catch up. I do not give patients hormones right away. Let's see if they can convert. Fixing the gut, conversion of T4 to T3 should be better. More active T3 hormone. That's the idea how to do this, doing everything the same time. I present it to them. Most people hop right on it because they understand. You wait for what, 4 more years? Maybe then you're not welcome to come here anymore. Maybe then you need to find oncologist.
Right.
And let oncologists do it. Is it biological oncologist or just conventional oncologist? So let then oncologists take care of that. Now we see so many issues. Let's deal with this now so you never have to do this. So some hop right on it. Some, I'm going to need to think about it. They come back 2 to 3 years later. And now their request is, you know what? They found something in my CAT scan, or they found something in colonoscopy, endoscopy, something is in my breast. But we already covered that. And then the advice is, you know what, now, please have it taken care of with whoever oncologist is because their area of expertise. Let them do what they need to do. When you're in remission, you're more than welcome.
Yeah, that's one of the reasons why my daughter said, Ma, you have to start doing podcasts because you're seeing all the patients, young people with all these real diseases that they should not have. And you're like seeing abscesses and cavitations and root canals with that going the infection into the brain, into the mandible that travels to the nerve back into the brain. And people have the vagus nerve off and they have all these different things going on. And I figured if we can save one person's life, doctor, while doing this podcast, that would make me happy because prevention is the best thing. There's two kind of patients, the ones that are like trying to be biohackers, anti-aging. What else do you have? What else is there on the toolbox? And then the other people that are numb, they're numb to the fact that the body is the temple of the Spirit of God and you're responsible for the body. So what is it that you can do, like the water filtration and resting and things that are under your control? So I want to ask you, you're in Boca, I live in Boca. And one of the things that it really worries me, the patients are coming to get the root canals out, on the meridian of the breast, but they're getting breast cancer and they put breast implants. So how is that going to, what do you think about that and the impact of having a plastic bag above your heart and above your lungs? What do you think the body does with that?
So I don't think I know because I see it. I will tell you, some people, very seldom, very small amount of people absolutely not responding for a while for that. And some people very much triggered. It's always a matter of time when body starts getting triggered to this implantable device. So for those who have breast implants in them, there is a complication, which actually it's not a complication. It's a physiological state of progression. It's called capsular contracture. And people think it's a complication and they want to break up the capsule. It's not a complication. It's innate ability of a body to protect itself. So it
Yeah.
creates this very specific capsule around the implant and holds implant intact. So the implant by itself, not with contact of the tissues of the system. So system is so beautifully designed by God. Nobody can
Mhm.
design it better than God would, right? So all
Yeah.
mechanisms in place to protect the system. You have this thing in there. So let's create a little capsule. And sometimes the capsule gets really tight. Like when you understand capsules getting really tight and breast is getting hard, you understand there's systemic problems already because body's trying to do everything to protect. Again, when do I bring it up to the patients? When women come and she cannot get pregnant and I examine them and we do blood work and I do specific testing for them as well, I do tell them this area of your breast is inflamed. They need to understand why. Did you menstruate? When did you menstruate? So I can understand where they are in fertility window. It's menstruation. So obviously, and then they tell me, oh, by the way, I have implants. I was like, okay, we're going to do blood work. We're going to see if your immune system is already triggered. Something for you to think about that these trigger immune response as well. So yes, it's your decision to do whatever that you want, but I just explain to patients what body does. Its decision is on them. I explain to them that's response of the body because something that doesn't belong is in your system. So the same as, the root canals, the implants in the mouth, all the same things. So we are not created to have all of these things in our body. I also have patients with surgical mesh injury. That's another thing. And it's always mystery condition and people don't know where to go. And to me, it's very obvious. Very first appointment, even before they even come to sit and speak with me, the symptoms are very specific. I always get the story. Tell me, please, how you're feeling, what's bothering you. Oh, what happened 6 months before then? What happened a year before then? And it always comes up, always. And my question is, have you ever relayed this information to somebody you spoke with? Did you explain this? First, nobody asks. Secondly, people say there's nothing wrong. Yes, there's autoimmune disease. They don't understand where it's coming from. But now, surgical mesh, it's necessary. That's why it's placed. I understand it, but we never can take it out. It's not the breast implant that you can take out. It's not removable. Now we have these people that need this care for the rest of their life so they can live the life that they want to live. They can go on vacations and not be always inflamed. They can live their life as active and happy as possible because now this is part of their system. So they need to do something to constantly keep it clean.
Detoxification.
Very specific, very gentle detox. And I tell them very first moment when I understand what they're dealing with, I tell them, you need to understand this is not removable. Nobody will remove it for you because it goes and it fuses with tissue. So if it's fused with the tissue and you pull on it, you pull everything out. I have women that have mesh in their pelvic cavity to support their bladder, uterus up. If you pull on that, you're pulling all the guts out. You're pulling all the organs out. Nobody will ever do it because damage will be so severe. So that is very specific patient category that I have. And I tell them, you need to now remember, no matter what, you need to take care of yourself. You have to be a priority for your own being. Because if you don't care about you, who will care about you? That is so important.
So we spend a lot of time doing preventive education for the patients, because the best dentist is no dentist. And we spend a lot of times, hours, teaching people how to care for their teeth and their gums and how to prevent grinding and all the different things. Now, in your field, is there a way for a person to prevent certain things, like you're speaking about meshes and things like that? Is there something that the patient could have done when they were younger? I don't know, exercises, building up muscles. What can you tell me about that?
So firstly, we need to understand what patient we are talking about and what we want to prevent. So most of the people that come to me, if it's not your high-end CEO that wants to be hyperactive and, doing everything, and they're not have any symptoms yet, because that's big load of my patients that want to be optimal all the time. They don't wait until something is wrong. These are the best people, because there's like, how can I do and what can I do so I can be as active, as functional as possible? They're already doing everything. They're doing a lot of things. They just up a level and keep them at this optimum level as long as possible. Lots of times I have patients that come to me and they say, oh, I go to my doctor and my doctor says everything is fine, so I just want to prevent. I'm here for preventative medicine. I look at them and their stomach is out of here, big stomach, they burp all the time. And I tell them, I was like, if you're no longer there, you don't need prevention, you need treatment,
Right.
education, and then you need to be educated how to maintain your body in optimum level. This is not prevention.
Yeah.
Prevention when you're absolutely well and you have no problem,
But
right?
that
So we need
we
to
all,
understand what is really prevention.
that's wonderful, because, we all have blind spots. And some of us are more critical of everything than others. But you're absolutely right. When I look at a patient, I look at them from the top to the bottom. I'm looking at skin color. I'm looking to see if they're getting blood flow, if they have sleep apnea and they're not getting enough oxygenation. You can tell right away. If they have diabetes, you can tell right away. You look at the extremities and you see that they're purple, they're not getting enough oxygenation, that they have some kind of COPD, and they're not even aware, because people kind of grow into this disease, and they think they're okay. Like you said, if I see a male with a belly, I know that this person doesn't have the same blood flow to all his body parts, because you cannot have fat in your stomach and your heart be working okay. So how do like, are your patients like ready to receive information, or how do you do that?
So I'm very open and honest with my patients. Of course, choice is all theirs, but we also have choice to who to offer care to. We have to match. They need to understand, yes, this help is yes offered, only offered for those people who most probably will benefit because they will follow. It's very specific relationship. We do
Right.
a lot and we invest a lot in our patients because we know once we invest and they follow, the outcomes are amazing. But it has to be very specific kind of patient. Firstly, people that are proactive and they want to restore the balance in their body. What we
So for a
see a lot,
woman,
yeah.
for a
Go ahead.
menopausal woman, for example, and I agree with you, as soon as you go into menopause, you lose your brain. You're like, totally, it affects you so much. So what kind of a hormonal replacement do you use for postmenopausal women? Like
So,
people that are
firstly, if you
already.
want to treat these women right, we don't need to wait until they're postmenopause. We need to treat them in their perimenopause so they don't have that shift of hormones.
Right. And what age would that be?
Everybody is different age. Usually it's like in the early to mid 40s. Usually when women stop menstruating, as soon as she became menopausal, it's usually 8 to 10 years before then, where we
Right.
need to understand that they need help. So the first hormone that drops first, it's always progesterone. So this is when we know women get diagnosed with very specific cancers because it's not enough progesterone. So progesterone is very specific hormone that drops. And once estrogen becomes very high and women become estrogen dominant, estrogen is very inflammatory hormone. And it causes a lot of issues in very specific parts of the body, such as breast, uterus, and ovaries. Women think, oh, I'm now menopausal, I'm clear. No, you're not. You're now actually more in risk than you were before. because now you don't have progesterone. So progesterone would be the first hormone I would replace. One.
Okay.
Okay. Then I would look, of course, at their thyroid markers. Perimenopausal and menopausal women, their thyroid hormone no longer optimal. So we need to
Mhm.
see how we can optimize that. Can we optimize that by improving gut function and liver function? Because the conversion happens in the gut and the liver to help
Um,
her this way. If it's impossible and she has Hashimoto's thyroiditis and thyroid is destroyed, then we need to replace that. If this lovely woman is dying from hot flashes and she cannot sleep because of that, now we need combination of estrogen and progesterone that she needs to use, a right combination. Her system is sufficient because we have the systems in place to proper function when everything is in place. And of course, now women in mid is now they're done with their job, they're still working, but now they are at different level. Now they are CEO of the companies, the owners of the business. They need to function and they have no capability
I
because
ag- I agree with you. I
they
see it.
they
Yeah.
lose their cognition, they lose their memory capacity, they become very specific. So all of this is reversible. Like we don't want to wait too long. So what I see happening, as soon as women become perimenopausal, cortisol goes up. Once cortisol goes up, inflammation goes up as well. Insulin resistance, they become more insulin resistant. You see, everything shifts. So we really need to be very careful how we guide these people so they can function best, so they can recover. So it's quality of life as well. When you cannot think properly, you cannot enjoy your life. You're depressed all the time because that follows. They gaining weight like there is no tomorrow. Where's the quality of life? I'm not even talking about sexuality because it's such an important part in life. These women are either married or they have a relationship. They are relationship problems. So it's a whole being and it is so important. Adrenals need support. Whole system, whole endocrine system needs a support, and this perimenopausal and menopausal period is so important. But once we do it, it's just beautiful thing. People just change, and it's absolutely amazing.
I agree with you 1,000%. I see it. And now after COVID, the stresses have gone up so much. People are more emotionally unstable. I see that more anxiety for whatever reasons. And I would definitely recommend a woman after 40 get help before you make everybody else around you crazy because, they get irritable and we can see, very a lot of unstable behaviors. And we see it a lot in our office because, not only a person doesn't have the hormone support, but they also have an added anxiety due to the fear of even being in the office, so it's like when you see the people at their worst, right? When people are fearful and then they have all these medical, unbalances. And, when you see, better because you're an expert in what you do, you see the difference from before and after. And in your heart, you want everybody to be happy and joyful and peaceful and balanced. So it's so important. What you do is so important. I want to ask you, you have the video on YouTube that I love about the 5 R's. So do you want to walk us through that? You have been speaking about it, but so people know what the R's mean, the first R, the second R.
Sure, absolutely. So when we're talking about 5R method, we're talking about firstly reveal stage. And reveal stage, it's always finding the root cause. Where is problem coming from? So it is usually during consultation, then we do blood work, we do specific testing to understand what's going on. So we know what to concentrate on in the beginning. We're going to remove obstacle. This is our remove stage. So removing obstacles, we need to do remove stage in proper time. We don't
Are
do
you trying,
detoxification.
Dr. Marina, are you trying to show us something on the screen?
What's going on?
No, I see you now, but I didn't see you for a moment.
I didn't do anything.
Okay, so now you're back.
That's weird. Can we then, should I say it from the beginning so we can?
Yeah. My daughter can
Okay,
edit that part.
that's odd.
Yeah, it went blank like a paper white.
Oh, that was very funny. Okay, so first stage in the 5R method, it's reveal stage. So firstly, we want to understand what's going on with the patient to understand what's causing the state of this being, right? Whatever that is. Are they feeling tired? Are they feeling depressed? Are they feeling anxious? What is going on and where it's coming from? Is this the endocrine disruption? Or maybe it's toxicity. What's causing this? Then we are talking about restorative phase. Where can we start restoration? How can we restore and what needs to happen in restoration phase? There is replace phase where we find out what's missing and we replace it what's necessary for proper function. Body also needs to regulate. We also guide patients through regulatory phase.
I'm
And we
writing.
do removal of obstacle phase. And this is where active detox. But again, we don't do it in the beginning. You can't because people simply going to get sick. So we want to
Right.
give patients the nutrition, teach people what to do right, how to sleep, regulate their anxiety, regulate the toxic load, teach them how to do things right so they have that energy to detoxify properly. We also would like to prep patients to proper detoxification, making sure that their lymph is prepared. It's not thick, it's not jello. So
Right.
if lymphatic system is not prep and it's very thick and somebody does any kind of detox, these patients in bed for a week, not proper. Get their lymphatic system flowing, make sure the kidney is active, liver is active at the moment, skin is prepared. That is not lazy. So when patients come and they're constipated, please don't do any kind of detox when patients are constipated. So even our gut detoxifies. Gut is very active in lymphatic system and drainage. It's part of lymphatic system as well. So we need to make sure these patients go to the bathroom on a clock once, twice per day. Once all of this is met, then we detoxify. And people almost feel nothing. I use herbs, I use medicinal, I use homeopathy to detoxify. I use an IV bag, specific liver detoxifiers that I use. I use glutathione. Sometimes I use NAD as antioxidant. I use taurine. I use alpha lipoic acid. Every patient needs specific things for support. And that's how it is provided. That's why change is so different. It's evident. And usually patient that's, come and starts working with us, they start reporting changes first few weeks. It's not, you don't have to wait for months to see the difference. We
So
reduce
what
the
kind of
inflammation. So important.
what kind of tests do you do? Like I have a patient just call me in and she told me I did a genetic testing and they found out that I am having my own body attack myself, itself.
Also, autoimmune disease. Okay.
So she was saying, "Oh, I was doing glutathione and B12 and all that, and actually, my body gets worse."
Right.
She was having it almost like every time she had any kind of treatment by anybody, her body was having some kind of a very aggressive mast cell reaction.
I will tell you why. So mast cell activation, we need to understand if she's able to detoxify. Most probably she's MTHFR gene mutation. Maybe she has
Right,
double mutation. So for
right,
patients with double mutation, you have to be very careful when you're detoxing them. They don't have proper ability, number one, to convert into active folate form. They don't,
right,
do this. So B vitamins are not active and they don't work. They don't turn them back to normal and body doesn't use them. So she's probably is double MTHFR gene mutation patient. So
right.
when I test my patients, everybody gets tested for this. And now
Yeah,
most of my practice, single and double mutation of MTHFR gene.
yeah.
I
40% of people
me
are.
almost 85,
Yeah.
almost maybe
Wow.
one or two patients that don't have. For past 3 years, I probably had 3 people that don't have MTHFR gene mutation.
So what do you do with a patient like that? Like I'm like that. I have double
So
MTHFR.
right. So you have to be very careful how you treat these people. So all the B vitamins have to be always methylated. And these
Yeah,
people really don't do well with glutathione.
right.
They don't do it. It's like causes such a big reaction. For these
Yeah,
patients, I don't give glutathione. There are other things I use that work just great.
yeah,
Glutathione is not for these people. People don't
right.
understand. So, in order to have very profound effect on the human body, everybody should have their own specific design for them protocol.
Yeah,
It's not copy paste because everyone is so different.
exactly.
It is
So
very
that's
specific
wonderful. So
way of
you
treating.
you do the genetic testing and then do you do also the what kind of gut bacteria they have?
Yes, it's a gut zoomer. I do it sometimes. I will tell you, I do my best not over test my patients. I
Yeah.
do very specific wellness functional test with AI interpretation that gives me idea about entire system.
Yeah.
So I do my best not to spend my patients' funds in too much testing. What I get
Exactly.
first, it's more than enough for me to understand how to allocate their funds and the sequence.
Right.
Everybody has very specific sequence. So
Yeah.
not two
There's a
patients are
lot of,
exactly the same.
yeah.
Everything is individualized. So I do my best not to do too much testing. I know that a lot of practices, they run so much testing. It's about $5,000 of testing, where when they treat people, it's very general. It's
Uh,
very generalized. It's not specific to this patient need, and people don't have great results. You're not just to test, you also should have ability and understand their physiology and guide them before you're doing further testing. So me understanding that they have MTHFR gene mutation, single or double, I already understand a lot. Just that one test.
right.
It's just one test. Plus, I do everything else that I need to do to understand the cardiovascular system and risks, metabolic system and risks, system and function, liver function, kidney function. Like this, I already get that. And I get AI interpretation. So of course, I know how to interpret, but I would like my patients to see so they understand what I'm talking about. So first appointment, they come to me, I already tell them what I see, but we are
Mm,
evidence-based practice, and
yeah.
everything has to be backed by evidence. When the blood work results come back, I show them and I tell them, by exam that first time, first reveal, I told you have A, B, C, D, and F. The rest, we'll see if something else is there. So all this A, B, C, D, and F now evident here. Now you know you have this. And now this is a plan how we're going to overcome this. It's
So I have
very
a question.
specific
Yeah.
roadmap to
I
each
have a
patient, very
question for
specific.
you.
Go ahead.
We do the DNA biopsies on all the teeth that we remove when we have the root canals. And we get all these microorganisms at very dangerous levels. A lot of them are parasites, amoebas, molds. What is your protocol to treat somebody that is loaded with parasites from the root canals that they had in the mouth?
So first of all, again, we have to go into the base. Before we remove anything, we need to find a state of stability where body can function. You cannot remove anything if they don't have tools to remove those.
Right,
So we start somewhere in the beginning, and always we need to understand, when I do testing, these parasites come up in percentage.
right,
I will tell you, in one case, lovely lady came to me. She's very early 40s, completely menopausal. She didn't think about having kids yet, where she stopped menstruating altogether. She's also very physically active because she's a personal trainer, beautiful woman, beautiful. And I told her, like, something is causing this. We need to understand what. Maybe you're overexercising, number one, because you're spending too much energy, not much left. And also very possible that you are, struggling with parasitic infestation. How much of that you have in percentage, we need to understand. So did blood work, 100% full of parasites. So we do not forget these parasites also eat and feed off of the tissue of the body, nutrients, they eat it, right? So when people eat for themselves, they're not just eating for themselves. Parasites feed off that too. Very important understanding. No matter what we do, we cannot get rid of all parasites. It's impossible. What can we do? We can suppress them and strengthen and regulate the immune response when the immune system can actually control parasitic infestation and how parasites reproduce. This is very, very important. For people with mold, I have those people too. I also have
right.
people with Lyme's disease that come. People with Lyme's disease are very interesting. So the way they're presenting very much with people who are suffering with long-term COVID. Very similar, because COVID, parasitic, Lyme's, tick, parasitic. It's two parasites. They're not for you to thrive, right? So they're parasitic. And treatment exactly specific. Where do we start? How do we support the system so the system itself, the immune system, can start controlling? We start antiparasitics for people in different times. Somebody at 4 months, somebody in month 5 or 6. It depends if they are ready or not. So they don't have adverse effects. So once we get things out and suppress, we regulate immune system from day one, so immune system can't suppress. So when I do blood work, I pay attention into levels of eosinophilia, how many eosinophils. That's body's response to parasites. You know that. So also for iron, the gallbladder function. So a lot of different markers will explain to somebody like me if patient is dealing with parasitic infestation. We treat them, we do blood work, and then we see eosinophils are back to normal range. So we've done it, right? We cannot, for intestinal parasites, you can never get rid of them completely. Impossible. If somebody says it's possible, it's impossible. And I'll explain to you why it is impossible. Parasites reproduce this very fast rate. If we are cleaning them out and we're suppressing their growth and we kind of, putting them to sleep and getting rid of them, those that are sexually active, they reproduce at thousands of eggs per day. So think about it. You're getting rid of some, how fast they are reproducing. Do you think you can overcome that? When people make very specific statements, we're going to kill all of your parasites. In order to kill all the parasites, you're going to kill the human being.
Right.
You can't do it.
The parasites start telling you what to eat.
I see this all the time. So when patients come to me,
Candida, the yeast is telling you what to eat.
Exactly.
Sugar.
So
have that ice cream, have that bread.
Yes. So they take over nervous system and they start controlling the nervous system where people cannot control their cravings.
Yeah.
I ask my patients, what do you crave? Oh my God, I crave sugar so much. I can't control it. I was like, okay, you passing by, I have a piece of chocolate on my table. For example, can you pass by that piece of chocolate? Nope. Usually they come, they grab whole big piece and they eat everything at once. They can't even stop. This is not the first time. I don't keep piece of chocolate, just an example. I say, if it would be, what would you do? It's like, oh my God, it would be done.
Yeah.
I can't stop myself because I explain to my patients, now this parasites, whatever that you have, now is controlling your mind so you can feed it for reproduction.
Yeah.
All it is, the same as mold, the same with candida, it's the same. So we do it so well, but we don't do this in the beginning because mentally it's very challenging. Can you imagine all they can think about is sugar and you take it away?
Yeah.
Of course, we take it away. We explain it to them. And again, my patients one time a week, they cheat. And I tell them, listen, how much you cheat, you will understand next day what you did to yourself. So it's not me who caused all of this. It's you who did it because you're not listening to your body. It's very important. People need to learn to understand their body desires.
Yeah, the body's telling you what to do. When patients have mercury fillings, there's going to be an overgrowth of candida in the gut. And
Yep.
I have patients that we have removed the mercury, and you can see that there's almost like a volcano, like an eruption of yeast coming out of their throat, like a reflux. When we start doing their cleanings and whatever, you see all that. And once we remove the gum infection and we remove the mercury, they do their detoxes and they come back, you see a radical change where you don't see, obviously they cannot eat sugar. I had a young patient that came and I said, you are not going to eat sugar, no carbs, nothing for a month because we did this. And he said that the first month was the hardest. He literally saw that his gut was telling him what to do. And because I told him not to do anything with sugar and carbs, that he did a conscious effort, but he said it was a battle. It was like fighting a demon, but he was able to conquer that, which really changed his medical history. Radical medical change. So, you are gifted. You can do anything in the world, and you chose to be a healer. So I thank you for that because it takes a lot of caring, a lot of love, a lot of dedication, and a special anointing from God to care for somebody, to want to investigate how you can help them. So I want to thank you for that because, you're a very special person. So, we have so many different questions about, stress and unresolved trauma and things like that. If you were going to speak to somebody, who's listening that is afraid of dementia, that is afraid of, getting something irreversible like cancer, what would you say to them today? You didn't know this maybe 10 years ago, maybe 20 years ago. what would be your gift to somebody that's listening to us? What can they do?
So, firstly, they can do a lots of things to help themselves. A lot. Number one, get rid of that fear. That's number one. Fear is never, it's never your friend. It's actually going to
Right.
loop you in different direction and everything just falls apart. That the fear destroys people. That's what happened during COVID. People got afraid, people were full of fear, and it's really looped them somewhere else. So find your inner peace. It is very important enough. Forgive yourself. That's the first thing. For yourself first. That will ignite healing very gently, very gently. For somebody who's looking for professional help, find somebody who you resonate with who can guide you through the steps. And again, you have this for decades, maybe your entire life, because people carry trauma. It could be multi generational trauma. Does it mean you have to now live with this and then take it with you? No, no, no. There are things that you can do to get rid of that trauma, to release that trauma, and to change your future. I do this in my practice. It's very interesting. My patients absolutely love it. You don't need to do too many of these sessions. You do few and you a transformed person because that luggage that you bring with you, you're able to leave it behind. So new doors open. And once people overcome the trauma, the nervous system shifts from stress to now repair and rest. It is very interesting how body does it. We need to understand that the soul is smart and resilient. So is body and very smart and resilient. You just have to find and show the pathway.
Beautiful. I love what you're saying. Be centered, center your spirit, center your thoughts, you know. The Bible says at the beginning was the word, and the word said, and then it was. So there's power in words. Not only God has that power, but God says, control your tongue, renew your mind. So that way you actually are in generating positive energy. The first toxicity you have to get out of your body is your own thoughts.
That is true. Also, believe and you shall receive.
Yes,
So when people are
yes,
in fear, they believe something already. So if they
yes,
believe of this, if they
yes,
believe this will gonna happen. So it's very important the belief system. So when the patients
yes.
come and end up with me, I always find out their belief system. If I can shift their belief system and we can ride on new belief system that they can heal, they heal. There are also
Right
people that
there.
come and say, you know what, no matter what I've done, this doesn't work and nothing will work for me. If you can't shift that,
It
they
was
already
nice meeting
decided.
you. Yeah. You cannot help. Yeah.
I still give them a chance. I was like, let's see if we can do this together. And I start putting this, planting that seed. I was
Yeah.
like, with A, B, C, D, and F, this
Right.
could change. That could be your future. Most people will follow that. But if somebody says, you know what, I've done this and I simply don't believe this, that's it.
Yeah. You cannot help somebody that doesn't believe. We are empaths. So, people that are toxic and have a lot of toxic thoughts will affect us. So, we have to protect also, you know, and choose wisely who we're going to treat, because if somebody is fighting against you and your ability and your gifting and your guidance, because a lot of the guidance we get from God, God talks to us about the patients, what their needs are. So I want to close in prayer. I want to thank you. I love speaking to you. There's so many topics that we didn't cover, but like you said, it'll take multiple sessions to go through it. But it gave me a good idea of what you do, and how you walk the patients through the 5 R's, and then the importance of following all the different steps, because you cannot do 3 R's and forget about the last 2 R's, and the mindset. I love what you do, and I'm looking forward to stopping by your office and checking
Sure.
everything out. I want
Sure.
to pray and close in prayer. Father God, we thank you so much for the gift of wisdom that you have given us, and you have guided the doctor through all the years that she has been treating patients and her evolution into where she's at right now. We thank you for the brilliance of the human brain and for the hope that healing is possible. For anyone listening who feels fear about their memory, their future, or their family history, we ask for peace to settle over their right now. Replace anxiety with clarity and replace confusion with direction. Guide us to be good stewards of the bodies that you have entrusted to us. Help us pursue truth discernment, and restoration, physically, emotionally, and spiritually. And bless the work of Dr. Yuabova, and she's seeking root causes and she restores hope and who serves with integrity. And remind us that we are not defined by diagnosis and genetics or statistics, but by the purpose that you have given us. We thank you for this day. Bless Doctor and her practice. In the name of Jesus, I pray. Amen.
So be it. Amen.
Thank you so much.
Thank you very much. It was fun. It's always fun. I love
Yeah.
podcasting. I do it almost regularly. So I'm
Yes.
really hoping that patients that listening and watching this podcast now can understand much better how body really works. We are one beautiful system created by God. So we should learn to respect and love
Yes.
firstly ourselves and then everybody around us.
That's it. Thank you so much, Doctor. I appreciate for what you do. God bless you.
Thank you for
And I
having
hope
me.
that
Thank you.
we do one soon and we'll choose another topic. But that was very, very informative. God bless you.
Thank you. Have a great day.
Yes.